and thank you for joining us for the Evidence Review Information webinar. This webinar is for people selected for evidence review. If you were selected for a peer assessment, there's a different webinar to watch. My name is Dana Perchi. I'm the Director of Professional Practice and Quality Assurance at CASLPO, and I've been here for almost 5 years. I'm a speech-language pathologist, and I worked in the pediatric world, both in public and in private. I enjoy talking to people, even about peer assessments and evidence reviews. We understand that this can be quite anxiety-provoking, but almost all registrants who've been through peer assessments or evidence reviews say that they were valuable and positive experiences. Our goal today is to give you lots of information to help you through it. And with me today is Caitlin Reed.
Hi, everybody. Thanks for joining us today. I'm Caitlin, and I'm the SLP advisor in professional practice and quality assurance at CASLPO. I've been with CASLPO since May 2023, but before that, my clinical experience was with adults with acquired communication disorders and dysphagia in rehabilitation hospitals. Like Dana, I speak to registrants all the time in practice advice, and we are here to support you. There'll be lots of time to ask questions today, but if you think of something after the webinar has ended, you can always reach out to us and we're happy to help. So just a couple of minor housekeeping items before we get into the content of the presentation for using GoToWebinar. It's best to close other running applications to help maintain a stable connection to the platform. If you experience any technical issues, exit GoToWebinar and return into the session, and you can do that at any time. This session is being recorded, and we will post the video to CASLPO's website on the peer assessment page within the next couple of weeks. All participants are muted today, but you can ask questions by typing into the question box. Just a minor note, it's easier for us to view if you include your whole question in the body of one message. Otherwise, we see them come in as like rows on a spreadsheet and they get mixed in amongst other questions and it's harder to understand. We do have breaks for questions throughout the presentation, but you can submit questions at any time. We'll try our best to answer everything today, but if you submit a question we don't get to and it isn't answered in the content of the webinar, please feel free to email either Dana or myself afterwards. In the question period, we will try to pick more general questions that will be beneficial for everybody to hear the answer to. If it's something that's specific to your individual situation, it's likely better to email Dana directly than pose your question here.
Today, we wanted to go over 3 topics to help you through this process. We'll start by talking about the intention behind evidence reviews and peer assessments, as well as why CASLPO does them. We'll talk about the process so that you can meet deadlines, use your self-assessment tool as indicated for uploading evidence and using comments. And lastly, we'll make sure that you know where and how to access the resources that are available to support you with this process. Attending today's webinar is a great start.
So we'll start with a refresher on CASLPO's role as the regulator of audiologists and speech-language pathologists in Ontario, what that means, and how evidence reviews fit into this. So sort of the why of evidence reviews. CASLPO's mandate, which is set out in the Regulated Health Professions Act, or the RHPA, is to regulate individual audiologists and speech-language pathologists in the public interest. Regulation is done through 4 main functions. The first is by confirming that entry to practice criteria have been met through registration. Second, by developing minimum standards of practice that patients can expect to receive from the professions. Third, by ensuring that registrants maintain their competence through annual participation in the quality assurance program. And fourth, by responding to concerns and investigating complaints about individual audiologists and speech-language pathologists in Ontario to uphold public trust. These are what we kind of term the 4 corners of regulation. It's better to think about this from the patient's perspective. So for example, when we ourselves have been a patient seeing a healthcare professional, like our family doctor, for example, we all expect that someone has verified that they're qualified to practice, that's registration, that they continue to learn and grow professionally throughout their careers, that's quality assurance, that we can at least expect a minimum level of care from them, which is the professional practice standards, and that there's a mechanism to address if their practice has fallen below this minimum level, and that is professional conduct. All CASLPO registrants who hold either a general or an academic certificate of registration are required to participate in CASLPO's quality assurance program. Quality assurance is a fundamental component of health regulation to protect the public interest by ensuring that healthcare professionals are meeting minimum standards in their practice, engaging in continuous learning and staying current throughout their careers, and providing safe, quality, ethical care to patients. All health regulatory colleges in Ontario, governed under the RHPA, are mandated to have a quality assurance program that includes requirements for continuing education, self-assessment, peer and/or practice assessment, and monitoring of registrant participation. For CASLPO, completing the self-assessment tool annually is one component of the quality assurance program, and peer assessment and evidence review is the other. As I said, all general and academic registrants must submit their SAT annually by the January 31st deadline. While that's happening, at the same time, 200 registrants are randomly selected annually to participate in either a peer assessment or an evidence review.
We have all the information that we're talking about today will be in the evidence review guide on the peer assessment section of the website. So we can look at that now. So if we go to the home page, hover over the word registrants, and in the middle, you'll see quality assurance program, self-assessment tool, and peer assessment program. So if you click on peer assessment program, that's where you'll see all the guides. Most important for you is the evidence review guide, and it's available in English and in French. We also have a document on information for employers, more about quality assurance and the peer assessment and evidence review process. So we often get the question that we always want to answer about why does CASLPO make us do peer assessments, and why did CASLPO add evidence reviews to peer assessments? So again, quality assurance, including peer assessments, are not a CASLPO decision, but legislated by the Regulated Health Professions Act. All 26 health colleges do some form of peer assessments. So your doctor, occupational therapist, dentist, dental hygienists, they all do quality assurance and peer assessments. Peer assessments measure audiologists and SLP's knowledge and skills to ensure they're meeting CASLPO standards of practice in the public interest. Through peer assessments, we support registrants improve practice by providing education and resources, and assist registrants to improve their skills so they can provide safe, effective, quality care. But we're a small college. When we started doing the evidence review process, we were only doing peer assessments for about 2.5% of registrants, which is not statistically significant. CASLPO needed to increase the number of registrants that take place in QA to strengthen public protection. So indicators selected for the evidence review are based on risk of harm and higher risk to the public when the standards are not met. We have data on which indicators registrants need more support with, so we're focusing on all of those. We are asking you to upload evidence for 18 out of the 30 indicators on the clinical self-assessment tool, or 14 out of 22 for non-clinical. If an indicator is not applicable, you don't upload evidence for it. So out of these, it'll be a maximum of 18 or 14, but out of these, the peer assessors will be looking at evidence for pre-selected indicators. The peer assessors have all been assessed themselves, and they know what it's like to be in your shoes, and then they went on to become peer assessors. They go through annual training and take on a number of peer assessments and evidence reviews every year. They're warm, kind registrants who want to give back to the professions. Peer assessors in this process are not out to get anyone. This process is not punitive, and it can be a really positive learning experience. In the evidence review, there's less interaction with the peer assessors than in full peer assessments. Peer assessors will reach out to you through email when you're first matched to say hello and let you know when they're planning to look at your evidence. They will also be in touch via email if there's anything missing or insufficient evidence. If they're satisfied with your evidence, you may not hear from the peer assessor again, but receive a synopsis instead. We'll talk about that a little bit later. So now we can talk about the evidence review process itself and what you need to understand. This slide just introduces the timeline for peer assessments and evidence reviews throughout the year, and we'll go through each of these steps in more detail in the coming slides. As you know, all general and academic registrants complete the SAT by the end of January, and this doesn't change. The date for you is still to submit by January 31st, and this is the basis for the evidence review. We don't need to go through the self-assessment tool today because it should be pretty familiar to you. Let's start by talking about the practice description. You want to ensure that this reflects your role as we use it for matching, something Caitlin will talk about shortly. Section 8, as you can see here, has a box for provide additional details of your practice. This is what the peer assessor will be looking for to know about your role. Section 9, please be sure to put in your email address. That's how the peer assessor reaches out. And keep your email up to date. For example, if you go on leave from work, we need to be able to contact you. In fact, if you go on leave, please contact the college to let us know. You don't need to write in when you want the evidence review to take place with the boxes here, but we do have another bigger box for you where you can let the peer assessor know if you'll be away from your email or unable to respond. Maybe you're going to your cottage for the summer and have very poor Wi-Fi, or you'll be out of town and not able to make changes to your evidence. Put something like that in there. Talking about evidence, again, you're submitting your SAT by January 31st, no changes there. The indicator evidence submission date is March 7th. So you have to submit your SAT on time and either have some evidence in there or update it afterwards. You do not need to resubmit your SAT once you put in evidence, just hit save after you upload. You're uploading evidence to the 2026 SAT. For the evidence review, you do not need evidence for all indicators. The evidence review guide shows which indicators must be from patient records and which don't have to be, and we'll look at this in a moment. Patient records evidence is key to this process for the clinical evidence reviews. Please don't submit blank forms for consent or case history. Evidence needs to be from a minimum of 5 patient records, and we highly recommend that you use comments to elaborate or explain your evidence. Non-clinical, it's 1 piece of evidence for each indicator, and obviously nothing from patient files. We have an article from the newsletter, The Express, in February 2020 that we've also attached to this webinar on tips for peer assessors. You might want to read that before you upload your evidence. If you work in more than one place, you can upload evidence from both workplaces. Evidence can be up to 3 years old, although newer evidence is preferred. We suggest that you use the comments. These can be really helpful for peer assessors to understand why you uploaded what you uploaded, especially since you won't be talking to them. Now we can look at the evidence review guide. This is a really key document for your preparation, especially the chart on page 6 for clinical and page 8 for non-clinical, and these charts are duplicated at the end of the guide. The chart tells you specifically which indicators need evidence. So let me click over to that. So here is our evidence review guide. As I said, you can go down to the chart and it'll show you which needs evidence. So you can see here 1.1 is missing. You don't need to upload any evidence there. For clinical, all of the indicators that are needed need 1 piece of evidence except for 2 indicators. They need more. For audiologists, that's 1.3. I perform and document the controlled act of prescribing a hearing aid for a hearing impaired person according to practice standards and the position of the college. For this indicator, you need evidence from 2 patient records for all phases of hearing aid prescription. That's the hearing assessment, the hearing aid prescription, verification, and validation. That means there should be 8 pieces of evidence for 1.3. For speech pathologists and audiologists who supervise support personnel, 1.5, I'm accountable for support personnel providing intervention under my direction. You need 2 examples of evidence showing different aspects of supervision. That could be co-signed records, consent, maybe a meeting in your calendar note. And again, I will say this, 1 piece of evidence for the selected indicators. The peer assessors will only look at predetermined indicators from that bunch. We understand that you're working really hard at your jobs, and this is not intended to be a make-work project. 1 piece of evidence. To look at exactly how you can do this, we suggest that you take photos or screenshots of your evidence and send it to yourself. If you send it to yourself by phone or by email, make sure that you delete it completely. And upload a file. We recommend keeping a folder on your desktop that has everything so that you can keep it all together. Maybe you want to change something or can't upload it all at once. Also, having it on your desktop gives you a way to rename it. So you don't need to, but some people find it easier, since you need to have from 5 records, to have something that says PR, patient record 1, 2, 3, 4, 5, instead of patient names. If you've already uploaded and you didn't do this, not a problem. But I might change this one to say this is PR1, and this is for 1.3, and this is about validation. So this would be very helpful to me to remind me what I'm uploading, and also to the peer assessor so that they know what it is they're going to be looking at. Please use letters and numbers, no special characters, because the Skillshare SAT program doesn't really like that. Also, be sure to check your evidence and make sure that it's not upside down. Check it out before you upload. And you can see information on page 12 of the guide. Let's look at some evidence now. Obviously, this isn't real evidence, but if we look at evidence that someone fits the CAT puts up for 4.3, I communicate respectfully and collaboratively with patients, relevant others, registrants of my profession, other professions, and or coworkers and employees. So when uploading a page from a patient record, it's best to show the whole page. There's no need to cross out all the information, but you can just highlight what it is that you want the peer assessor to look at. So here, fits the CAT would have put a yellow box around it. We've seen registrants draw on arrows just so that the peer assessor knows what they're looking for. Now we can upload something to the self-assessment tool so that you see the process. Again, this is all laid out in the guide, but it might be helpful to look at it together. So if you go to professional standards, you might never have noticed that it says before required for peer assessment, upload evidence, and the comment box. Maybe you have, but now's your chance to do it. So let's upload something to 4.2. I communicate in a manner that is responsive to the unique background, identity, and experiences of the patient, relevant others, and other professionals. Hopefully you've noticed that we have guidance. So these are documents or other places that you can look for information. And we have a list of examples. These are not necessarily things that you want to upload, but these are here to give you an idea of what you could upload. So when you're ready to upload, you can click on the required for peer assessment, choose your file, and it will take you to the folder. So here is my handout for 4.2. I'll click on open, and I see it here, choose file, upload files, and here it is. Again, we really recommend that you use the comments, a brief description. Please don't write a whole essay of why you chose that evidence. It can add a lot of information for the peer assessor, especially since you're not having a conversation with them. They'll see your evidence and your comments. So for this one, I might say something like, this is a handout I made for a 6-year-old child and their family who speak Urdu. Visuals and pictures with words in both English and Urdu, or whatever else it is that you want to say. And so when you're ready, you have everything up that you want to, you can go to the top or bottom of the page and hit save. Now, let's say I have this lovely thing that I've added, but it turns out I put in the wrong one, or maybe before March 7th, I have better evidence. There's a little red stop sign to the left. You click on it, and the system will ask if you want to delete it. If you say okay, it'll disappear, and you can put in something even better. A note on redacting, because I'm sure that's a question that you have. Do we need to redact personal health information? And the answer is no. The Regulated Health Professions Act supersedes the Personal Health Information Protection Act, and the self-assessment tool is very secure. However, if you want to, you can. We may hear from organizations that they have concerns about uploading personal health information. If you or your employers have concerns, please call us. There's no harm in sharing with the privacy officer or your employer about needing access to files for the evidence review. Again, all regulated health professionals have peer assessments, so hospitals and larger organizations will be familiar with this. We do have a letter for employers on the website, and the company that runs the SAT has a letter that can be provided. I don't understand it. It is very jargony, which to me means that it's very safe. Again, you don't need to redact any personal health information, but you can. Maybe you'll take out the patient's address or their name, but keep the date of birth or anything that seems like it would be relevant for the peer assessor to have. Also, you don't need consent from the patients to use their files for quality assurance. Another tip is that if you're uploading an email as evidence, it might be best to actually include the email as a PDF instead of reproducing the email on a Word document, because this might be a little less compelling for the peer assessor since it could have been recreated.
So while you're uploading your evidence, as Dana just demonstrated, the peer assessors are attending their annual training, and CASLPO staff will be matching you with your peer assessor. You'll be matched with a peer assessor in late March or early April. We match registrants and peer assessors according to your profession, your area of practice, and what language you speak, which is why it's important to accurately complete the practice description section in the SAT. For unique roles, we do our best to match you with someone appropriate. You'll be given the name of your peer assessor and a link to their entry in the public register. You can have one veto of a peer assessor. If you choose to use your veto, notify CASLPO staff within 1 week of receiving the email, and a different peer assessor will be assigned. You don't need to provide a reason for using a veto, and the choice to veto a peer assessor will remain confidential. Once matched finally, you'll get an introductory email from your peer assessor. They'll let you know what month they plan to complete your evidence review. As Dana mentioned earlier, this may be your only interaction with the peer assessor. If you don't hear from your peer assessor by the end of April, please let us know. Be sure to check your junk folder just in case it got filtered out there. The email from the peer assessor will come from their own personal email address, not a CASLPO domain, so keep your eyes peeled for that. If the peer assessor finds that your evidence is insufficient or does not demonstrate that you're meeting the standard indicator, they will send you an educational email copying Dana, which will explain which professional standard indicator needs more or better evidence. The email will also include potential resources like webinars, articles, or CASLPO practice advice documents for you to reference. The idea is that this will guide you on what should be included and how you can improve your practice. So for example, the peer assessor may want to know more about what you say when you obtain informed consent for services. So for example, uploading a consent checkbox isn't enough information. This is why the comments box is very useful to provide elaboration. You will have some time to look at the resources and decide how to upload better evidence, demonstrating learning. There's a short timeline for uploading new evidence, which must be done within a maximum of 4 weeks. It's important to be responsive when the peer assessor communicates with you and to meet the assigned deadlines. Have your evidence uploaded by the March 7th deadline, and make sure you have new evidence uploaded by the date the peer assessor tells you if they request it. Email your peer assessor to inform them that you've uploaded new evidence so they know that they can review it. There is only, in an evidence review process, there's only one opportunity to upload new evidence. Make this change to your practice moving forward. Don't just change your evidence. It's intended to be a great learning opportunity for improvement in your practice.
And because of the way that this is laid out, if you do get an email from your peer assessor and you have questions, absolutely reach out to Caitlin or to me or any of the other practice advisors so that we can help. So what happens after the evidence review? There will be a synopsis. The synopsis is short. It will indicate which standards were reviewed, which were met. Even if there was virtual remediation, it will say that it was met. If the peer assessor feels that further work is needed after the virtual remediation, it will be described in the synopsis. You are sent a copy of the synopsis and have 30 days to respond to the committee. And the synopsis will be forwarded to the Quality Assurance Committee as soon as your response is received for their next meeting. So if you have no changes or questions, we suggest replying right away. Waiting the full 30 days to respond will prolong the process for review by the Quality Assurance Committee. So we often get emails that will say, thanks, or looks good, or okay, just to let us know that you've read it and we can keep the process moving for you. Your peer assessor won't tell you if your evidence review was successful. That's determined by the Quality Assurance Committee. The synopsis and any information you send are anonymized. The Quality Assurance Committee will not know your name, just a PA number. And you might see on some of your documents, PA 30026. That is the peer assessment number that we have for you, so that the quality assurance doesn't have your name or information. The peer assessor will have your PA number, but they'll also have your information because they have to be in touch with you and they have access to your SAT and your email. The Quality Assurance Committee will direct you on how to proceed. They'll decide if they need more evidence or if you've demonstrated the required knowledge, skill, and judgment based on the evidence. The committee meets approximately every 6 to 8 weeks. You'll receive an email letting you know the final decision of the committee, hopefully congratulating you for completing the process. That's when you know you're done. If you like, after receiving this email, you can remove your evidence from your self-assessment tool, again, using the little red stop sign. After completing the evidence review successfully, you cannot be selected for an evidence review or peer assessment for 5 years. You'll also get a survey from the quality assurance team. You may feel like you do these all the time, but the feedback has been invaluable and informs future peer assessments and evidence reviews. How could this process be better if we don't hear from you? So let's look at our timeline again. January, you were informed you were selected for evidence review. Maybe you've started collecting your evidence. You've completed and submitted your SAT by January 31st and participated in the information webinar just now. In February, you can continue to collect and upload evidence. Again, you do not need to resubmit your SAT, just hit save. In March, ensure that all the evidence is uploaded and complete by March 7th, and you can use the checklists that we have available. In April, you'll be notified of your peer assessor. You can request a new peer assessor if you choose, and the peer assessor will contact you to confirm the timing of the evidence review. From May onwards, that's when the evidence review happens by peer assessor. They will only contact you if remediation is needed, and then you'll get the synopsis and the QAC decision. Okay, we've been doing a lot of talking, but I think that some questions have been coming in, so we will take some time for questions now.
So we have a question, somebody just asking to briefly show again where we can access the chart that showed which standards require evidence from this process. If you're able, Dana, to show the website where the evidence review guide is.
Sure, absolutely. So I'll even go to it from scratch. So if you go to CASLPO.com, there are links to all of this in the email that you received earlier. But if you go to CASLPO.com, hover over the word registrants, and in the middle we have quality assurance program, self-assessment tool, and peer assessment program is the one that you want. Click on peer assessment program, and there's a few guides here, but most important for you so that you are only uploading to maximum of 18 indicators is the evidence review guide in English or French.
Hopefully that helped. We have now some more questions coming in, and pardon me if I'm looking over here at my other screen.
Yeah, exactly.
Just to confirm, we only need one piece of evidence, not 5 different files for each standard. Correct. So of the 18 indicators, if you're doing the clinical evidence review, there needs to be evidence from 5 patient files scattered throughout those 18 indicators, not 5 pieces of evidence per indicator. You would just upload 1 per indicator, unless it's one of the 2 that Dana mentioned, 1.3 or 1.5. So hopefully that clarifies. Maximum of, no, not a maximum, 5 charts that you're pulling your evidence from, and then 1 piece of evidence per indicator.
And you can use more than 5 charts. We often get that question. But again, we're not trying to give you extra work. This is not something that you need to take extra time to do. It's like with, and this question would have come up, but there's always a question again on redacting information. This is not an arts and crafts project. You don't need to sit there with your black marker and cross things out. But think about what, first of all, you don't need to cross anything out because the RHPA supersedes PHIPA. But if you want to redact information, what makes sense to redact? And in the same way, you can look at, you can think about what evidence you have that you want it to best represent you, but this shouldn't take hours and hours and hours of your time. You are very busy people, and that's not the point of this. The point is to know that you're meeting the standards.
Yes, and maybe we'll do one more question, then go through the rest of the content, and then we'll go through the remainder of the questions at the end. We've had this in our webinar for the registrants selected for peer assessments this morning as well. A lot of people are asking, can you use evidence from 2026, or does it have to be the previous 3 years? The point is that it's just recent evidence that's reflecting your current practice. So you can use evidence from 2026. It just can't be older than 3 years. It's meant to be reflective of what you're doing now.
Okay, so we will have more times for questions in case we didn't get to yours. But let's just keep going now. So the last section that we wanted to talk about are the resources, and we've gone over some of them, but we just thought, hopefully now that you have a better sense of what's happening, we could look at them again. So even though I just showed it, this is the peer assessment web page. We have all of these different guides on here, but again, the evidence review guide is the one for you. You're welcome to look at the peer assessment guide or the non-clinical peer assessment guide, but those are not the steps that you need to take. If you take one thing away from today, I think it would be picture me with my one finger up, one piece of evidence. We want you to show how you meet the standard. And so often, people will think, well, let's see, for 1.2, I need to show that I maintain records in a reasonable time. Maybe I should upload a report. Maybe I should upload a session note, or maybe it should be a late session note to show that I know what to do if I'm entering things late. Pick one. Be creative in what you choose. Think about what best represents you. And remember that the college is protecting the public. It's not that the college thinks that you're bad at your jobs. In fact, we know that most of you are amazing, but this is the way that we can show it to and protect the public. If you're feeling at all anxious, you can reach out and we can connect you with someone who's been through an evidence review in the past. Again, this is your opportunity to demonstrate how you practice. If there is an area that you need help to meet the standard, that's okay. That's what quality assurance is here for, so that it can help protect the public, help you to protect the public in all of your work. That's what remediation is for.
So before we share some registered feedback from the survey to end on, we're going to give you some final key takeaways. So the first is to help understand the evidence review process. We've created the guides and this webinar to help registrants as resources to refer to. Again, they're there to help you, and we encourage you to take time to read the guide and understand what you need to do and by when. Next, spend time being critical about what evidence to upload, but not too much time. Again, the intention is not that you agonize over this. Put in as much effort as is necessary to take it seriously and be confident that you're demonstrating you're meeting the standards. But anything beyond that isn't an expectation. Again, not to sound like a broken record, we would strongly advise against uploading multiple pieces of evidence per indicator. Sometimes more isn't better, it's just more. It makes more work for you, more work for the peer assessor, and can actually make it less clear to the peer assessor how you're meeting the standards. It makes it harder to identify amongst more information. Make use of the comments to explain your evidence. This is your opportunity to explain to the peer assessor how this evidence shows that you're meeting the standard, and add any context if it's needed. So for example, how your workplace applies a certain policy, if that's what you've chosen to upload. Particularly in evidence reviews where there's no other communication with your peer assessor and no discussion, the more that you can explain your evidence in the comments, the better. Leverage the resources built into the SAT, including the guidance and examples of evidence in the drop-down menu beside each indicator. They're there to help you. If you need clarification on anything after you've read the guide, you can always contact Dana or me, and we're available to help you. But we did want to take this chance to explain the limits of the support that we can offer to help manage expectations. We will annually get feedback on the survey saying, oh, I wish we'd gotten more explicit examples of for this standard or an explanation of what this standard means. Just to cushion and again manage your expectations, we won't be able to tell you what evidence to upload or whether the evidence you've chosen is good or not for a couple of reasons. First, we as staff members don't have legal decision-making authority per the Regulated Health Professions Act, so we actually can't say whether something is acceptable. That's limited to the Quality Assurance Committee. And second, that would undermine the integrity and fundamental purpose of the evidence review. Ultimately, demonstrating how you're meeting these minimum standards in practice is your responsibility as a self-regulated health professional. This is about your practice and how you meet the standards. If we respond to a question with use your best clinical judgment, we certainly aren't trying to be intentionally unhelpful. It's just that the question has probably gone outside the parameters of what we're able to help with and has veered into something that you'll have to decide on your own. And lastly, be responsive when your peer assessor communicates with you and make sure that you meet all the deadlines. If they ask you to upload new evidence, don't find that stressful, but let them know when it's ready for them to review. These are easy things to do to help the process go smoothly, and they're entirely in control.
We wanted to share some of the comments that we get in the surveys at the end of the year. This is from last year, and these really do reflect the themes that we have. So one person said, now that it's all been completed, I view this process as a great opportunity for professional growth. I wish I had the same clarity and confidence from the start of the assessment as I did afterwards. This is exactly what I try to convey to my SLP friends. As experienced professionals, they simply need to view this as an opportunity for growth and that the entire process is very flexible and welcoming. You might not feel that way now, but really it is. Okay, this takes us to our last time for questions.
Okay, we have had more questions come through. A couple people have asked, can you use the same piece of evidence for more than one indicator if it demonstrates meeting the standard? Sure, that's it. Yep, that's possible.
Sorry, it's probably not as much fun to watch us read. For non-clinical evidence, is it necessary to provide patient charts? No, as a non-clinical audiologist or speech pathologist, you probably don't have patient charts. If you think that you have, I don't know, maybe you're in management and you have some sort of policy or some process that you've put into place that you think would be well demonstrated by an audiologist or speech pathologist on your team's charts, then you can use it, but there's no expectation for you to have any patient records.
We've had a couple people ask on the difference between an evidence review and a peer assessment. Just because it's come in multiple times, I'll just give a brief explanation, but don't worry about peer assessment. If you are here because you were selected for evidence review, that's the process that you need to understand. And the notification email that you will have received will have indicated which stream you are in. If it's evidence review, then you're in the right place. Evidence review can be thought of as more of a screening process, and the peer assessment more of a full assessment. So as we said, in evidence review, you're not uploading evidence for all the indicators, all 30 in the SAT, just a select sample. Your peer assessor will look at them on your own, and that's the extent of it. Whereas in a full peer assessment, the the requirement is to upload evidence for all 30 indicators, and then there is a virtual interview with the peer assessor that involves multiple parts. You discuss your evidence with them, you go through your learning goals and CLACs. There's a clinical reasoning tool component to it. None of that occurs in the evidence review. That's why it's a briefer process.
Oh, there's so many great questions on here. If I work across two settings, am I required to distribute my evidence between both settings? This is where your professional judgment comes in. What makes sense to you? I can tell you that the consent information that I had when I worked in the public versus the way that I did it privately, the public stuff was much better. But on the other hand, I actually would have wanted feedback on what I was doing in my private practice. So maybe I would have done one for informed consent and one for knowledgeable consent, but it's up to you. And if, sometimes if you work in the public, like as a SLP in school boards or PSL, the consent forms are so good that it might not reflect what you do when you're doing things independently. So really think about what shows me, me, Dana, as an SLP, how can I show how I practice to someone? There's a very cute question here. I think it's cute. Should we respond to the peer assessor's introductory email? I don't know. That's up to you. Peer assessors are not expecting anything. If you email them with questions, they may not respond, or they'll say, please talk to Dana or Caitlin. And they're not trying to be rude, but this is, think about a screening and an assessment. This is very, very hands-off for the peer assessors. But if they tell you, hi, my name is blah, and I'm going to look at your evidence in the summer, you're welcome to say, hi, nice to meet you. But that's just a personal choice, I would say.
Yeah, it's more of an issue if they happen to ask you for more evidence and then you don't respond, and then the evidence never gets uploaded, and then they're not sure what's happening. That's more the problem. If they respond and they ask you for something, just respond, just be responsive, and it helps everybody be clear and on the same page about what's happening. Somebody asked, what would live or recorded review mean in terms of evidence? Are videos useful? So we had this question this morning as well. There's a limit to the storage in the SAT. So if you have a video of something that you think would be helpful, or an MP4, you can try uploading it. It causes an issue. It's better just to take a still and upload the image instead of the video.
But really, I would say use your professional judgment. So if you think there's something that instead of uploading a document for, video would make sense, or a picture would make sense, go for it. But use your professional judgment to think, what will demonstrate to the peer assessor what I'm doing? And it also depends on what the indicators are. So again, maybe we'll even just look at the guide one more time. So for instance, one of the indicators that is not on here is about IPAC, information, infection prevention and control. That's something that someone might want to put a picture or a video of the hand washing stations. But as you can see, well, maybe you can't because you probably don't know, but it's not in here. It's not something you have to upload evidence for. So that's not something you need to worry about. Sometimes there's people that upload evidence to all the indicators, to which I would say they probably didn't attend this information webinar or review the guide. And that's a lot of work. You don't need to do all of that work. This is just a maximum of 18. It probably is not 18 because for SLPs, you should not be prescribing hearing aids. For audiologists, perhaps you're not prescribing hearing aids, or perhaps you don't have support personnel. People that work in the public might not be advertising or having patient financial records. So it's really, we say it's a maximum of 18 for clinical and 14 for non-clinical, but it's very likely that it is less than that.
So we have a couple of people asking just for clarification on what is being submitted in the SAT. What's the difference between what we have to submit by January 31st versus March 7th. So by January 31st, it's the same as any other year where you submit your SAT. You rate yourselves on the indicators in your 2026 SAT, and then you go back to 2025 to put in your continuous learning activity credits, or CLACs, associated with the goals from last year. So think about what's coming up, which is your new goals for 2026 that you set, and rating yourself on the indicators is for the year to come, versus looking backwards, which is how did you do on your goals from last year and what learning did you do associated with them. So you do your SAT as normal, rate yourself on the indicators for 2026, set goals for the upcoming year. And then by March 7th, pardon me, is when you need to have all the evidence uploaded for the indicators listed in the guide. That's what your peer assessor will be looking at, is the evidence that you've uploaded for those 18 indicators. Hopefully that helped clear things up and didn't muddy the waters any further. Dana, do you have anything to add?
I don't think I do. We have already some specific questions about what can I upload? Can I upload this? Can I upload that? As Caitlin told you, we are going to give you the relatively unhelpful answer of use your clinical judgment or use your professional judgment. And we really aren't trying to be unhelpful, but this is where your professional judgment really does come in. So hopefully we've answered all of the questions. I'm just taking a super quick look. I think that was everything. But again, it'll be okay. And if there's anything that you're not meeting the standard, or that your evidence doesn't demonstrate you're meeting the standard, and you get the email from the peer assessor, that's okay. This is your opportunity to learn. I feel like most people think, oh no, can I lose my license? No. I mean, if things go really badly, like you say, well, I don't bother to keep records and I never get consent, I can't even think of, like, I never do this properly, things won't go perfectly. But the idea behind quality assurance is that we're there to support and help before there's a problem, in order to protect the public. Really think about what it is that Caitlin was saying about why we have quality assurance.
Yes, quality assurance is, if you can think of quality assurance like preventative medicine, which is just to prevent something from going wrong in the first place, as opposed to having to address it after it's already happened. So, yeah. Which is more reactive.
Absolutely, it's a lot. It's nicer to deal with quality assurance than it is with conduct, if I could put it that way. Although they also are wonderful people. Okay, so I think that brings us to the end of our webinar today. We will post this shortly, either this one or the other webinar. We'll be choosing one of them. Hopefully this answered any of your questions. If you think back and there's something that you didn't get an answer to, that you think we can answer, do feel free to reach out. Good luck, everybody. Wishing you all the best.
Thanks for joining us this afternoon.
Bye-bye.